Welcome back. Now, a recent report has found the situation of young children has worsened since the COVID-19 pandemic. The South African Early Childhood Review 2024 says children are more likely to live in poverty, face food insecurity and malnutrition, and die before the age of 5. Ilifa Labantwana CEO Zahira Mohammed joins me now to discuss the report further. Zahira, good morning to you. We appreciate your time on ENCA this morning. I'd like to start here. The South African Early Childhood Review 2024, of course, highlights significant setbacks for young children that's post-COVID-19. Can you elaborate on the most critical areas where the situation has worsened for these children, Zahira?
Morning, Jenny Lee, and thanks to you viewers for listening. I suppose the point that I like to bring out is that things weren't great for our children before COVID-19. I think the pandemic just spotlighted a really bad situation for our little children. And if I must pick one key thing that's of significant concern to those of us in the early childhood development space, it's the fact that our children are hungry. We can use fancy terms like severe acute malnutrition and stunting, but at the end of the day, our kids are hungry. And if our children are hungry, it makes your mommies upset. It makes your caregivers feel really, really hard pressed to think, I can't feed my child because I don't have income to feed my child. And the long-term benefits around malnutrition for the young children are not only the fact that they're hungry. It's important because, yes, they're hungry now, and that's absolutely terrible to think of young children being hungry. It has long-term implications for their growth, for their development, for the ability to learn, and those have bigger ramifications for our economy at the end of the day.
And one of the interesting things, Zahira, the report also took a closer look at the plight of children in rural areas. Specifically, what does the findings say about ECD in rural traditional and rural farm areas, and how does it compare to the urban areas, for instance?
Sure. So I think what's also nice about the report is that if you can see the report, it explains that early childhood development is not confined to what is commonly understood as your creches. Early childhood development starts from the point of what we say conception, right? And it's your basic health, your basic services, your access to water, access to sanitation. All of that is part of a childhood experience. All of that forms part of early childhood development. So yes, children in rural areas are more hard-pressed just because we do not have access to basic services, or it's more difficult for them to have access to basic services. And hopefully, based on what the president said, he wants to see yellow machines everywhere. So hopefully we'll see more yellow machines and cranes in the rural areas just to make basic services more accessible. But I think what's important to point out that even though things are harder for children in rural areas, poverty rates and malnutrition and child hunger are growing in rural areas, in urban areas as well. And we've got to basically acknowledge that we have a growing urban population as well. And there's many children who find themselves living in your undeclared areas, in your township economy areas, who also suffer significant hardships because they also suffer from lack of basic services like those in your rural areas as well.
Zahira, when we hear words like poverty, that our children are exposed to hunger and likely to die before the age of 5, obviously that raises a lot of concern with all of us. So with nearly 40% of children under the age of 6 living in households below the food poverty line, as the report has indicated, what specific steps do you then think can be taken to address and ultimately reverse the alarming rise in child malnutrition and, of course, also the mortality rates?
Yeah, so there's multi-pronged approaches that we can take. And as I said, ECD starts from conception, which means we've got to make sure that that pregnant mom is taken care of, right? So we've got to make sure she's got access to the antenatal care that she basically needs, that she has information around that her mental health and well-being is taken care of. And most importantly, we've got to make sure that that mom has access to basic nutrition herself, because low birth weight babies are a good predictor of stunting going forward, and low birth weight babies are prevented if the mom gets the right type of high protein nutrition. So things like taking care of a pregnant mom at that point in time already sets a trajectory of that unborn baby going forward. Then after that, we've got to make sure that once that infant is born, that infant and that caregiver has got to have access to the child support grant from day of birth. That's not a new policy intervention we're talking about. It's an intervention that is phenomenal in this country. The gain is made and the contribution it makes, it's very important. And it's budgeted for, but yet our children below the age of 2 are not accessing that grant. And funny enough, or oddly enough, the lowest access rates for the child support grant are in your urban areas, your urban centres of Gauteng and Cape Town, where there's low access to our child support grant. So those are things that I think are critically important at the early days that we need to be able to take care of. And then on top of that, in terms of the from a nutrition perspective, the value of the child support grant has been severely eroded over time. We need to restore the value of the child support grant to the food poverty line, so at least the household has the minimum amount of income to provide the nutritious food we need for children to grow and to thrive.
Now, I would, of course, like to get your very, very brief input just on what the GNU, the Government of National Unity, you think can do to address this very briefly, if you would, please.
Sure. So the Government of National Unity brings, I think, more energy into the early childhood development space. It allows for more. It allows for more engagement. It allows for more. It requires a lot more collaboration that we've had before. Different voices around the table, and hopefully more platforms for civil society to engage our new set of government ministers to be able to jointly collaborate on what's important for our children, and also to allow for greater accountability to action some of the good policies we've just had in place for early childhood development.
Well, thank you very much for your insights today. We appreciate it, Zahira. That was Ilifa Labantwana, CEO Zahira Muhammad.